Measles or rubeola is also called as Khasra. At the moment, Mumbai and its neighboring districts are experiencing an outbreak of measles. It is a highly contagious viral infection and it spreads from contact with the patient with measles or through coughing and sneezing with airborne droplets of infection. Strangely enough, even when the patient with measles has left the room, the virus can remain suspended in the air for almost 2 hours. It is highly contagious and 90% of unvaccinated people in contact with the primary patient can develop infection. The incubation period of the infection ranges from 1 to 2 weeks. It starts with a high-grade fever, sore throat, runny nose, cough, and then a rash that develops from the face and neck and spreads to the rest of the body. The challenge is that it is associated with a lot of complications, and 3 out of 1,000 patients with measles can die because of lung involvement or brain involvement. Not just that, it can also lead to brain infection in the form of encephalitis, pneumonia, and ultimately growth retardation and delay in milestones in a child who has suffered from measles. The best way to prevent measles is to prevent contact with the patient with measles. It is very, very important that the parents don't send a child to school if he has suspected measles rash. Get your child immunized on time with vaccination with an MMR vaccine between 12 to 15 months of age, which is measles, mumps, and rubella vaccine, and a second vaccination between 5th and 6th year of life. If an adult has not had measles, they should get the vaccination done if it was left out in their childhood. One attack of measles gives lifelong immunity, but since it is a disease which is associated with a lot of complications, vaccination makes good sense. So be wise, immunize your child on time, and take the necessary precautions. Avoid crowded places. If the child has high fever and is drowsy, having breathing difficulty, is not accepting orally, please go to your doctor and get a consult done. Mind you, all cases of fever with rash are not measles, so your doctor is the best judge in terms of treating. The treatment is mainly in terms of symptomatic, but at the same time, it is important to look for alarm signs. So be wise, protect your child, and take all the necessary precautions.